I'm delighted to be here at this Clinical Research Forum meeting, which has so many good programs, including the celebration of clinical research. All of us who are concerned about research have great concern today by virtue of some of the economic pressures and the squeezes on NIH. But at the same time, we want very strong basic science research. We've got to make sure clinical research is supported, that young people who are looking at careers see this as a growing and attractive field and recognize that many of the ultimate new treatments come from that necessary component of research called clinical research. I want to particularly say how admiring I am of the leadership of the CRF, the Clinical Research Forum, which has included Rob and Bill, Crowley, and many others who've made this such an important and effective organization. We're going to continue it. We've got to get past this bump in finance and make sure that in the overall program of research, clinical research is right there at the center. I want to thank you all for what you do. Congratulations to the recipients of the awards this year and really to everybody who's working in this very important field. Thank you very much.
In this paper, 2 people with tetraplegia, that is 2 people who are unable to move their arms or their legs in any functionally useful way, were able to control a prosthetic or a robotic arm simply by thinking about the movement of their own paralyzed hand. And they did that using the investigational brain-gate neural interface system. So they thought about using their own arm and hand as though they were reaching out themselves with their own limb, and the robotic arm moved much the way their own arm would have moved. One of our participants, she reached out with the robotic arm, she thought about the use of her own hand, she picked up that thermos of coffee, brought it close to her, tilted it towards herself, and sipped the coffee from a straw. And that was the first time in nearly 15 years that she had picked up anything and been able to drink from it solely of her own volition.
Patients with severe sickle cell disease have very frequent pain crises. And the pain that these patients have is something that most people can not even fathom. It is so severe. It's been known that sickle cell disease can potentially be cured by bone marrow transplant for several decades, but you had to have a perfectly matched brother or sister. The use of the half-match transplants now makes the procedure available to the majority of patients with sickle cell disease. Perhaps as many as 85–90% of patients who need a transplant could now get a transplant. Not having to go to the emergency room 2 or 3 times a month, not having to be admitted to the hospital 1 or 2 times a month. I mean, it's just dramatic, the change that has occurred in these patients.
LCA stands for Leber's congenital amaurosis. It's a rare form of retinitis pigmentosa, which is a progressive blinding disease. Usually these babies are significantly impaired, and it's devastating because not only is their vision terrible at birth, but it gets progressively worse with age as the cells in the retina die off. A dog born blind with this very same condition. So the puppies that were born blind couldn't see their way around a room, and we tested the possibility of restoring vision in these little puppies by delivering the normal copy of the gene, which is defective. It's called RPE65. And lo and behold, these dogs began to see. And so those results led us to propose to test this same approach for treating blindness in young children. For these individual patients, it's so gratifying to see what they now can do that they could not do before. There are 2 things that I think are really going to be important from this. One, that we'll move forward with this particular disease and get approval for the drug that we've been developing. The other outcome that I think is really important is that this could be a stepping stone for developing a treatment for other blinding diseases.
research that we've done is really to apply sequencing to uncover what has happened in the genome, which we've only been able to look at in the past by microscopes. So when we look under a microscope, we can see a very big exchange of chromosomes in our genome, but we can't understand what has actually happened at those exchanges, what is actually disrupted in the genome and what has changed. What we've done is apply sequencing technology to those changes to figure out exactly what genes have been disrupted and what could possibly happen to an individual based on those disruptions. When we applied this in a research setting, what we did was find genes that have been disrupted in autism spectrum disorder that you would not be able to see under a microscope. So our work has really shown that you can provide very specific outcomes of what has happened to the genome that is very different than what you had seen under a microscope before. And really one of the main findings was that what you had always seen under a microscope was always incorrect. It was always at least a subband off. So the part of the chromosome that we thought was exchanged turns out to never be exactly accurate. And based on the accuracy that we can provide with sequencing, we're able then to predict outcomes that we never would have been able to predict.
I think what we're hoping to show with this study is, how much control can you get with this type of implant with a year of training, right? But down the road, what we're hoping is that this can become a fully implanted wireless system that people can actually use in their homes when we're not around for controlling a prosthetic arm or an implanted FES device, which is something that stimulates your muscles to restore movement of your own limb. Initially, we started out with her doing three-dimensional control of the hand, and so she's controlling the endpoint position of the arm, moving forward, backward, up, down, left and right, that kind of thing. And so since she was making good progress with that, we decided to try to add in orientation of the wrist, so rotating in all three directions, and then also adding in grasp. So that's where we're sort of focusing now on seven-dimensional control of this endpoint position, orientation and grasp, and sort of really working on interacting with objects and being able to move them around her environment.
I'm working with people who treat me like a teammate. I'm grateful for the knowledge and expertise that each one of them brings to this.
Jan's goal has really been to feed herself a piece of chocolate. And she got a nice big bite of the chocolate. We want to keep doing this and keep seeing what activities she's able to accomplish and get back to working with the limb to see how much control she can actually get.
Crohn's disease and ulcerative colitis are difficult conditions to live with. Patients can experience quite a bit of pain, as well as chronic diarrhea, inflammation, and bleeding. Worldwide, over 2.5 million people are affected by IBD. The good news is the medications that we have today are effective. The outlook improved significantly in the late 1990s when anti-TNF drugs were approved. Having said that, there is a compelling need to develop better therapies. The anti-TNF therapies, as good as they've been, work long-term in only a minority of patients. The findings that we reported in Nature in 2012 identified a total of 163 regions of the genome that confer a significant risk for IBD. Nearly 100 scientists in 15 countries and nearly 34,000 patients contributed to this effort. I do feel very optimistic because there are new drugs on the horizon, agents that block the action of cytokines or entry of inflammatory cells into the intestine. The genetic associations that we're uncovering are a big piece of the puzzle. It's like a detective building a case. All these bits of evidence combine to create a fuller picture and ultimately better lives for our patients.
So the major problem with melanoma, once it becomes advanced to the point that surgery is no longer an option, is that historically we just have not had a drug approach that could really forestall progression of the tumor on its way towards becoming ultimately a fatal cancer within a pretty short time frame. So melanoma in its advanced state is oftentimes a symptomatic condition. We learned with BRAF inhibitor therapy alone that we could rapidly, within a week or so, get patients to be in a better state of health by taking this pill twice a day, the most commonly used BRAF inhibitor that's now FDA approved, in fact. When we added a MEK inhibitor to it, what we did for patients and what individual patients really tell us about is that we basically gave them a better sense that they could control their disease for a longer period of time. We knew that BRAF inhibitors could work in the near term. The issue was the intermediate to long term. And we've made a major advance with this combination in terms of buying patients much more confidence about what that intermediate to long-term outlook is going to look like.
$1.5 million fractures occur in the U.S. every year, and by looking for patients with osteoporosis, we can treat them and reduce their risk of fracture later. I am Margaret Gourlay. I'm an assistant professor in the University of North Carolina Department of Family Medicine. We focus on women because they have osteoporosis more often, and most people who have the serious fractures, the hip and the clinical spine fractures, are women. We studied how often primary care doctors should order bone density tests to screen for osteoporosis in women aged 65 and older. We want to do that because if we treat osteoporosis, we can reduce a woman's risk of fracture later. Our study included about 5,000 women over age 65 participating in the study of osteoporotic fractures. We divided the women into 4 groups based on their first bone density test score. These groups ranged all the way from very good bone density in the normal range down to the thinnest bone density level that was close to osteoporosis. We followed the women for up to 15 years. What we found is that when women had good bone density scores on their first test, it took 15 years for 10% of them to develop osteoporosis. That was very good news for those women. They had stable bone density and they did very well. Women who had thinner bone density on their first test developed osteoporosis faster.
Aortic stenosis is a prevalent disease occurring in 5% of people over the age of 75 in the United States. Since this is a disease of aging, many of the elderly people who acquire this disease are not good candidates for surgical replacement of the aortic valve. Therefore, we've developed a new technique which is less invasive, which allows us to insert a new heart valve from an artery in the leg without opening the chest or performing open heart surgery. The study that we're discussing is called the PARTNER trial, designed to help us to understand how this new technique can treat these elderly patients with many other illnesses who have this very morbid and mortal disease. Not only do they live longer, but the quality of their life is dramatically improved. Literally within a month, these people's lives are completely changed and they can perform essentially all normal daily activities.
Look at the window between those 2 dark bands. You can't see them there.
For almost 60 years, prenatal testing has been available in one form or another. In most tests used today, pictures of the fetal chromosomes are examined for missing or extra pieces, but the analysis called karyotyping can only detect very large alterations. With a new technique called microarray, it is now possible to detect much smaller genetic changes. To see if this new technology could work as a prenatal test, Dr. Ronald Wapner of Columbia University Medical Center recently compared microarray to karyotyping in a study of over 4,000 pregnancies.
We were very surprised. Somewhere around 1 in 60 pregnancies or so had findings that were clinically relevant even in pregnancies that the ultrasound looked completely normal. Because we know that technology is leading us down a path where we will be able to find more and more information about the child, we have to start asking ourselves, what information should we be telling parents and how should we be using that information?
Annually, the United States government spends over $30 billion a year on biomedical research. At this level of expenditure, it seemed reasonable to ask the question, what has been the return on this investment in the past year? Therefore, the Clinical Research Forum, a consortium of over 50 leading academic centers, conducted a national competition to determine the top 10 clinical research accomplishments in the United States during the past calendar year. What is presented here represents a dazzling array of new opportunities to pursue diagnosis and therapy, from making patients who had had strokes more functioning, to new diagnostic DNA testing while in utero, to new treatments for cancer. We hope you agree that this has been a good return on investment for the United States.